So today I'm going to talk about an interesting case study. This is a recent penile implant surgery we did around three to 4 days back. So I will tell the history. So this patient, he is 43 years old. He came here with complaints of erectile dysfunction. He had zero erection. So now it is 2026. He had a history of aortic valve replacement in 2018. And from that, he is taking blood thinners like warfarin, and he is taking the maximum dose of warfarin. It's around 10 milligram he is taking daily. When we did his iron bleeding time clotting, his blood, like whenever he gets an injury, when he is on this medicine, his blood will like profusely bleed, which means like if you get a cut, like a tap how it is leaking, like that the bleeding will be there. So that is the issue he had when he came to us. So his INR, we checked, it's around 2.7. It is a value which indicates the bleeding time of this patient. So that was it when he came here. His HbA1c level, that means the sugar control level of him, was around 10.7. So this is a very high sugar level, sugar control. It's very much poorly controlled. His urea creatinine, which means the kidney function is also very much poor. His creatinine value is something around 2.3. The normal range is something less than 1.4, like that. So in this scenario, he came to us. We did a complete evaluation, and even we did a echocardiography, and we did a nephrology. We got a nephrologist opinion. Everything was taken. And as the patient wanted to go ahead with the penile implant surgery, he stayed with us for 2 to 3 days. We normalized his bleeding level. So the INR was brought something around 1.6 so that there will not be any intraoperative bleeding. This we did with the help of the fresh frozen plasma. So a lot of things which were going before the surgery for the first 2 days when we was here. So he has come here with his family. So they stayed us, and we did all complete medical evaluation, and we prepared him for the surgery. And day before yesterday, the surgery was done. So the surgery was done under, usually we do it under regional anesthesia, but for him we did it under general anesthesia because we don't want to take any risk, even post-operative hematoma of any regions. So that's what we planned, and the surgery went very smoothly. So the surgery, the implant which he had chosen was Rigi 10 malleable penile implant. The size which I had used for him is around 12 size. This is a 11 size implant. So we had all the sizes with us. 12 size was apt for him. Intraoperatively, the corpora was very much like a rubbery corpora. So it was very difficult to dilate the corpora. But we had our specific instruments, like I had shown you before. We had those cavernotomes. So these cavernotomes, what it does, like we are able to create a proper space. So I didn't place a low size implant because I wanted to get the best result for him, because I was very sure he will not be, this surgery only is a very difficult surgery for him, and he is not a suitable candidate for a revision surgery. So whatever in this surgery we are doing for him, this will be there with him for his life. So I never wanted to undersize him. So I wanted to keep a good size. Like what is his size, that's what I want to place it for him. So we did a lot of corporal dilatation, both proximally and distally, and we are able to create the space. And the implant was placed. The surgery was over. Even the post-operative analgesics, it was like very meticulously we have to give to him because his creatinine levels was increasing. And we are not able to give all the antibiotics which are used to give to him. But somehow we managed to maintain him, and as to prevent any signs of infection or any chances of infection, because 24/7 he was under our monitoring. So now it's the third day, he is pain-free, and there is no any signs of infection or no any increase in temperature or anything. Patient is comfortably walking. We made his INR level come back to 2.5. Why the INR should be made to around 2.5? Because as he had an aortic valve replacement, if the blood is thin only, the blood can flow through that new valve. If it is becoming like for us and all, the INR will be less than around 1 to 1.4, less than 1.4. That's a normal range. If you bring it to that level, there will be clot, and immediately the cardiac failure will happen. But by God's grace, everything went well, and now like how he came, he's there with us, and he is going to leave tomorrow. So this was an interesting thing a lot of things were involved in this. The patient's trust, because he had traveled around 10 to 12 hours to reach here. He came here with that family, with his family. He stayed with us. The first day only we told him this is not going to be an easy thing, and I told him very clearly, usually I do the surgery on the same day, but for you it is not possible. So I need to do all the evaluation and I need to get all the fitness, because this is not an emergency procedure. This is an elective procedure, and we had taken this procedure, we had done it, and I personally thank God, because we are, without any complications, we are able to make him go back to his home. And thank you. And this was so these are the implants used, and as you know, Rigi implant, it has a good concealability and it even has a hydrophilic coating. So that is one of the reason, because of his uncontrolled sugar levels, we went for this Rigi, because this at least it will reduce some more chances of infection. So we hope for him to have a good and happy life. Thank you.